Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Welcome to K&L Gates' Triage podcast series. My name is Leann Walsh, and I'm a partner in the firm's Raleigh office. I practice both in the firm's labor, employment, and workplace safety and healthcare practice areas. I'm also part of our firm's global COVID-19 response team, advising corporations and other businesses on how to respond effectively to the social and economic disruptions caused by COVID-19. As you know, COVID-19 is a global health emergency that has not left a single employer or healthcare entity untouched. In the United States, the Centers for Disease Control and Prevention, also known as the CDC, has been leading the charge nationally in providing guidance to the public, including employers and healthcare entities regarding safe and effective operations during the COVID-19 pandemic. This month, the CDC published guidance for healthcare systems and healthcare facility decision makers titled 10 Ways Healthcare Systems Can Operate Effectively During the COVID-19 Pandemic. The guidance covers 10 recommendations categorized in 5 buckets. 1. Worker safety and support. 2. Patient service delivery. 3. Data streams for situational awareness. 4. Facility practices. And 5. Communications. Today we'll be discussing the CDC's recommendations in that guidance document relating to workplace safety. First, the CDC recommends that healthcare employers understand and execute current infection prevention and control practices for COVID-19. To do so, for example, healthcare employers should ensure that healthcare personnel are well trained on the use of personal protective equipment, also known as PPE. As most listeners to this podcast may know, PPE is used every day by healthcare personnel to protect themselves, patients, and others when providing care. PPE helps protect healthcare personnel from potentially infectious patients and materials, toxic medications, and other potentially dangerous substances used in the healthcare delivery. However, PPE shortages are currently posing a tremendous challenge to the U.S. healthcare system because of the COVID-19 pandemic. Healthcare facilities are having difficulty accessing needed PPE and are having to identify alternate ways to provide patient care. Healthcare employers should follow all applicable PPE requirements, including those from the CDC, the Occupational Safety and Health Administration, and state and local public health agencies. The CDC's current recommendations include instituting strategies to optimize PPE, including implementing extended and limited reuse of N95 respirators, reserving N95 respirators for aerosol-generating procedures, creating extended-use PPE units where only patients with COVID-19 are provided care, implementing walk-up testing booths that allow healthcare providers to stand behind solid but transparent panels, such as polycarbonate, to collect samples for COVID-19, and tracking PPE supplies available using the CDC's PPE burn rate calculator. As part of executing current infection prevention and control practices for COVID-19, healthcare employers should also institute universal source control for all healthcare personnel, patients, and visitors, consistent with the CDC's interim infection prevention and control recommendations for patients with suspected or confirmed coronavirus disease 2019, COVID-19, and healthcare settings. Source control involves having a person wear a cloth face covering or face mask over their mouth and nose to contain their respiratory secretions, which may help reduce the risk of transmission of COVID-19 from both symptomatic and asymptomatic people. Under current CDC guidance, continued community transmission has increased the number of individuals potentially exposed to and infectious with COVID-19. According to the CDC, fever and symptom screening have proven to be relatively ineffective in identifying all infected individuals, including healthcare personnel. Because symptom screening also will not identify individuals who are infected but otherwise asymptomatic or pre-symptomatic, it is the CDC's current position that additional interventions are needed to limit the unrecognized introduction of COVID-19 into healthcare settings. As part of aggressive source control measures, the CDC recommends that healthcare facilities consider implementing policies requiring everyone entering the facility to wear a cloth face covering, if tolerated, while in the building, regardless of symptoms. This approach is consistent with the CDC's recommendation to the general public, advising them to wear a cloth face covering whenever they must leave their home. Second, healthcare employers should develop protocols for healthcare personnel to monitor themselves for fever and other symptoms of COVID-19, restrict them from work when sick or post-exposure, and to safely allow return to work after an exposure and/or suspected or confirmed COVID-19 infection. Presently, the CDC categorizes healthcare personnel into 3 classifications of exposure: low-risk exposures, medium-risk exposures, and high-risk exposures. High-risk exposures refer to healthcare personnel who have had prolonged close contact with patients with COVID-19, beginning 48 hours before onset of symptoms, who were not wearing a cloth face covering or face mask while the employee's nose and mouth were exposed to material potentially infectious with the virus causing COVID-19. Medium-risk exposures generally include employees who have had prolonged close contact with patients with COVID-19 beginning 48 hours before the onset of symptoms, who were wearing a cloth face covering or face mask while the employee's nose and mouth were exposed to material potentially infectious with the virus causing COVID-19. Low-risk exposures generally refer to brief interactions with patients with COVID-19 beginning 48 hours before onset of symptoms, or prolonged close contact with patients beginning 48 hours before the onset of symptoms, who were wearing a cloth face covering or face mask for source control while the employees were wearing a face mask or respirator. The CDC notes that the use of eye protection in addition to a face mask or respirator would further lower the risk of exposure. The CDC states that healthcare personnel in any of the risk exposure categories who develop signs or symptoms consistent with COVID-19 must contact their established point of contact, public health authorities, or their facility's occupational health program for medical evaluation prior to returning to work. Additionally, healthcare entities should establish monitoring programs for employees falling within the low, medium, and high-risk categories, and should follow the CDC's guidelines for healthcare personnel returning to work with suspected or confirmed COVID-19. Third, healthcare personnel should establish a plan for providing additional support for healthcare personnel, considering aspects such as mental health, parenting, meals, and non-punitive sick policies. For example, the CDC advises that all employees, especially healthcare personnel, must take care of their mental health. Healthcare personnel should call their own healthcare providers if stress gets in the way of their daily activities for several days in a row. The CDC also warns that people with pre-existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. The CDC further emphasizes that all employer leave policies should be flexible and non-punitive, meaning that they allow sick employees to stay home and away from coworkers as needed without fear of retribution or penalization. According to the CDC, leave policies should also account for employees who need to stay home with their children if there are school or child care closures or to care for sick family members. Fourth, healthcare employers should create plans to reduce staffing shortages. For example, when staffing shortages are anticipated, healthcare facilities and employers, in collaboration with human resources and occupational health services, should use contingency capacity strategies to plan and prepare for mitigating this problem. The CDC states that at baseline, healthcare facilities must 1. Understand their staffing needs and the minimum number of staff needed to provide a safe work environment and patient care, and 2. Be in communication with local health care coalitions, federal, state, and local public health partners, for example, public health emergency preparedness and response staff, to identify additional healthcare personnel when needed. For example, healthcare employers should consider hiring additional healthcare personnel, recruiting retired healthcare personnel, and using students or volunteers where appropriate. Fifth, healthcare employers should develop and maintain a communication plan for their healthcare personnel, patients, and the community, which may include virtual town halls, daily huddles with local leadership, calls with partners, emails, and phone conferences for staff, media briefs, and other elements. For some examples, the American Hospital Association has a helpful communications checklist for preparing for and responding to COVID-19, and its webpage also provides links to internal and external communication plans from leading healthcare entities. I hope you enjoyed this episode of K&L Gates Triage podcast series. More episodes in our series can be found at klgateshub.com, and you can learn more about our labor, employment, and workplace safety and healthcare practices on our website, klgates.com. Thank you so much for joining me. I hope you and your loved ones stay safe and healthy.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.